Hi everyone. It's Thursday, July 9th. Seems like all the days are starting to run together. I'm Rendy Murphy, epidemiologist and director of disease surveillance and environmental services at the Mobile County Health Department. We're here with our daily update on the effect of the COVID-19 pandemic on Mobile County. Worldwide, we have more than 12 million cases of COVID-19, more than 3 million in the United States, and almost 40,000 cases in Alabama. If you've been looking at the national news, you can see that the southeast and the western states are really struggling to contain their COVID outbreaks right now. We continue to see, incredibly high numbers of cases reported each day, and our epidemic curve is starting to get into sort of an exponential look to it, where we were hoping that we had kind of been able to flatten the curve for a while. It now is taking off. So in Mobile County today, we reported on 4,444 cases of COVID-19. 99 were reported yesterday. We have 313 hospitalizations that we know of. That's up a couple, and 141 deaths. I want to make a sort of adjust expectations. We have a lot of people think, oh, we don't have that many hospitalizations and deaths, but the problem is because there's been such an enormous increase in the number of laboratory results, our case investigators and contact tracers are struggling to keep up with the sheer volume of investigations that are needed. So whereas we get things like age and sex from the lab report for COVID, so of those 4,444, we know almost 100% of them, their age and sex, but things like race and hospitalization and death and illness duration, those sorts of things, we can't get that information until we contact them, and we have hundreds of cases that we have not been able to make contact on so far. So you will continue to see the number of hospitalizations and deaths lag in our daily report, lag behind the number of cases that are reported each day, which is increasing at a staggering rate. I will say that through the Alabama information management system that's used by hospitals to let us know daily how many people are hospitalized, how many are in the ICU, how many are on ventilators, we know that yesterday when we combined the number of people that were in the hospital with COVID-19, it was around 175, and that is twice as high as the number just 14 days ago. So maybe even just a week ago. So, the number of hospital patients that are currently in the hospital with COVID-19 is at a staggering high number, and again, twice as many as just a week or two ago. So a couple of media questions today. One is about hospitals going on diversion last night, or this is the report. Hospitals often go on diversion, but last night about 5:30 sounded like all of them were on diversion. Wanted to see if it's COVID related. So I'm not sure what services or departments, or if it was the entire hospital that went on diversion, but yes, we are seeing hospitals fill up, reach their capacity to house non-COVID hospitalizations and COVID hospitalizations. So this is likely to be a bad situation that continues to get worse. Also ask if I can give an update on how contact tracing is done and the lag, if any. Read an article that there are so many cases in the U.S. that contact tracing may become almost obsolete. Yes, it is true that we are behind in the investigation of COVID cases reported in the last few days. So it is sometimes the case that by the time we get around to contacting them, the contacts have already become cases. But we are still trying to do things like bring in additional staff, hire new staff, maybe do some triaging of the laboratory reports that come in so that we can continue to collect important information on our cases and contacts. But it is a daunting task, and even more reason that we need the community's help in slowing the spread of COVID-19 by staying at home if you're sick, covering your cough, washing your hands, wearing a face covering, and distancing yourself from others outside your household. Someone on Facebook commented that if they don't recognize a telephone number that comes up on their caller ID, they don't answer it. So if we get your voicemail, we will leave a voicemail and ask you to please call us back about an important public health matter. So please, if you get a voicemail from, from the health department, please call us back so that we can conduct an investigation and give you advice about if you need to isolate or quarantine, that sort of thing. So there's another comment here about deaths being certified as COVID related, and I believe this is maybe from a physician provider, and it is up to the physician or the medical examiner who signs the death certificate to indicate whether or not they believe that the death was related to COVID or if they died of something else with a COVID diagnosis. So, most everyone that is going into the hospital these days gets a COVID test. So if you go in for, a hip replacement and God forbid you not survive that surgery, if you got a COVID test and it was positive, that would be a death with a COVID diagnosis, not from a COVID diagnosis. So I'm going to pause here for a technical issue. Is it back on? Okay. All right. Are we on? Okay. Sorry about that. We had a small technical glitch. So I'll just restate this last question from a physician concerned about death certificates with COVID. And just to remind people that it's the attending physician or the medical examiner will sign a death certificate and certify a death that is due to COVID or not. So that is something that physicians do. So you can die of complications related to COVID disease, and that is clearly a COVID-related death. And some people, if you have if you're admitted to the hospital for, a major surgery, you will be tested, I'm sure. And, if you happen not to survive that surgery, and, okay. Okay, third time's a charm. All right, some other, just some information shares. I was asked last week sometime about, when people lose their sense of taste or smell from COVID, does it return? When does it return? And I didn't have any information with which to comment on that last week. But there is a report out, and I have some copy here from a BBC News report, but there was a study conducted of some people in Europe who report COVID patients who reported alteration in their sense of smell or taste. Around 113 people. It's a small sample, but at least we have some information. 55 of them, so nearly half, reported that they fully recovered their sense of smell or taste. 46 had improvement in their symptoms, and 12 found that their symptoms were unchanged or worse. And this is, again, after their other symptoms had improved, but they continue to experience. So it looks like it likely will return. It just may take some time for that to occur. Another thing I want to mention, there is some fake news out there, a report that says, on Facebook, that OSHA says masks don't work and violate ocean mask levels. This is not true. This is not something that the Occupational Safety Health Administration said. OSHA has not said that masks don't work against COVID-19. So just wanted to sort of debunk that rumor. That is a false report. And then another article that was published in the CDC Emerging Infectious Diseases Journal, showing that under laboratory conditions, SARS-CoV-2, the virus that causes COVID-19, can remain infective in aerosol up to 16 hours, according to a study out of Tulane and published recently. Found that the virus can survive in the air much longer than other similar coronaviruses like SARS or MERS. So just to remind you that this research was conducted in artificial laboratory setting that doesn't factor in real world conditions like UV light or wind, but the authors believe that these findings have practical implication because it is sort of more evidence that this virus is unlike many others that we have experienced, and that the research that the virus may linger in aerosolized state for up to 16 hours should, demonstrates that the virus is more resilient than similar viruses, and that public health measures should be heeded. So again, even more reason to wear a cloth face covering when you are out in public to prevent the expulsion of respiratory droplets and prevent the virus that might become aerosolized and linger in the air around people that are unassuming and don't realize that they may be getting infected. So I believe that's all I have today, unless there's anything on Facebook. So again, just to remind people about the proper wearing of a face mask, hopefully it has loops, but if it doesn't, just tie it behind your head. Make sure that it goes over your nose and under your chin. Right, this is the proper wearing, and you need to take it off by the loops when you do remove it, but we need it to be over your nose and your mouth. And then at the end of the day, ideally drop it in the, hand wash it or drop it in the wash, or if it's a paper mask, throw it away after it's soiled so that you can keep this clean. We hear a lot of conspiracy theories about how, masks can kill you because you're breathing in your own CO2. And that's not true. I mean, we have had healthcare providers, dentists, doctors, nurses, surgeons, in masks for a very long period of time, painters, and there's no evidence that if you have a normal, healthy set of lungs, that breathing in your own CO2 incidentally, while wearing a mask is going to have a negative effect. However, if you do suffer from lung disease or breathing problems, things like asthma, we don't recommend you wear a mask because we want to make sure that you're getting plenty of air and staying healthy. So with that, we'll end today, and we'll talk to you again tomorrow on Facebook Live. Thank you.